So I want to welcome everybody to the Live Well Kalkaska Substance Free Coalition's Coffee with the Coalition Forum. This is an open and informal discussion about substance use disorders and related topics and concerns within Kalkaska community and Northern Michigan. So before we welcome our guest, I'd like everybody else to introduce themselves. I'm Suzanne Prentice. I'm the Live Well Kalkaska Substance Free Coalition Coordinator and Prevention Specialist for Kalkaska County. Jody?
Good morning. I am Jody Bellhorn. I'm from Northern Michigan Regional Entity. I manage all the prevention funding for 21 counties. Thank you for having me.
Yeah, thanks. Trooper McCauley?
I'm Trooper Mark McCauley. I'm the community service trooper for the Michigan State Police Home Lake Post.
All right. And this morning we're welcoming Donna Norcoli of Health Department number 10. Donna is here to talk to us about outcomes of a focus group of individuals in recovery. Take it away, Donna.
Hi, everybody. Thanks for joining today. In 2024, through a grant we had, Substance Use Stigma Assessment and Response, we conducted 3 focus groups of people in recovery, one in Grand Traverse County, one in Manistee County, and one in Wexford County. And even though they weren't in Kalkaska, I think the themes and the recommendations that we identified from these focus groups are pretty similar across our northern Michigan counties. The purpose of this report was to summarize and analyze the focus group findings, and then we wanted to assess the next steps to help individuals within our community. So we were trying to identify any barriers people in recovery have to maintaining their recovery, and also any needs that they have that maybe we could work on as a coalition or a work group. So we wanted to hear firsthand from individuals in recovery about their experiences. And that really gives us a lot of insight to the barriers they face and the resources they need. And so for the purposes of this focus group, recovery was defined as an individual with a past history of substance use disorder. So I'll kind of go through these one by one. I'll give you the Grand Traverse individuals in recovery highlights of the report first. So we asked them their reasons for beginning substance use, and we were, I guess, kind of surprised about the young age beginning substance use. Some of their quotes were, I was 11 years old when I started partying. By the time I was 10 years old, I was taking pain pills. I was 15, 16 years old cooking dope in the woodshed out back. There was trauma involved in a lot of the people in recovery. One person said it was a very violent upbringing. He watched his aunt stab his mother, and at the age of 8, he was beaten up by his cousins. They wanted to steal the grandparents' pain pills, and they're 8 years older than I was. Also, they talked about the culture and the social environment they grew up in. One person said, I'm pretty sure I had learning disability in school and I just drank to fit in, and that's the crowd that I related to. I was sick of being poor, watching my mom struggle. We were broke. We lived paycheck to paycheck. And so these were some of the themes that came up. One was, we should limit access to substances, provide education on substances and the importance of not sharing prescribed medications, because there were a lot of people that talked about like their grandparents having pain pills or, addictive medication that they could get their hands on. One person said, I started stealing my mom's pain pills when I was 8 to 9 years old. I started selling them when I was in middle school. My grandparents just had pain pills on pain pills on pain pills in their cupboard. They also talked about limiting prescriptions per patient of certain medications to prevent overuse or selling of substances. And one person told a story of getting hospitalized, and he started on prescription Norcos. The doctor gave him 750s, but he called a couple days later and said, "This isn't working." So then he prescribed me 160,000. Then I told him a couple days later I was depressed, and so he prescribed me Xanax. So, this overprescribing can lead to addiction pretty quickly. They also talked about increasing mental health services, providing help for mental health issues, and being able to create healthy coping mechanisms can help decrease substance use and chances of relapse. So one person said, "I started taking them initially because of depression." It all had to do with depression and anxiety, not being able to fit in. They talked about decreasing the time before treatment, not being able to get into treatment in a timely manner. So when they're ready to go into recovery, it's important that they could get right in. One person said the treatment center said they won't have a bed for 6 days, so I'm up here nowhere to go. They didn't have any beds available, so I ended up sitting the summer out and part of the winter in the homeless shelter. And then these were their recommendations they thought that we could work on. So coordinating treatment with the mental health services, increasing the spread of resources, and then actually connecting resources with homeless shelters, and then providing education on the safe medication storage. And they thought it would be good to provide education in schools since they tended to start at such a young age with substance use. So that was Grand Traverse County. Wexford County, we worked with Carrie Ziegler at Catholic Human Services, and she organized a focus group for us. And they were really all pretty excited and interested in sharing their stories. When we left from the focus group, one person came up to us and said, "Can we do this every week?" And we said, "Well, no, this is just a one-time focus group." So then Carrie actually organized, she calls it her sobriety, TEA, and they now meet once a week and talk about things and share stories. So, we liked that it had some sustainable consequences to it. So they said reasons for beginning substance use. A lot of them talked about lack of activities in the area, boredom and peer pressure. There's nothing around here. It's a small community, and it just seemed like everybody else was doing it. And again, the ease of access, saying this is a drug hub. You can get meth here cheaper here than you can in Saginaw. When it started, it was because I was raising 4 kids by myself, didn't have time to go. It was easier to get meth than it was to go to the psychiatrist. I can't take my kids to the psychiatrist with me. I can have dope dropped at my house, so it's easier to self-medicate. And that's why I started. They talked again about trauma. One person said they got off the marching band bus and found out that their dad had passed away. And that started at age 13. One person was in a domestic violence relationship. Her family called Child Protective Services. And so she ended up leaving with her kids with her mom and checking into detox. And again, they talked about young age, 12 years old, 13 started drinking alcohol, smoking crack by 14. easy access. I could walk right into the gas station at 15 and buy a half gallon of vodka without an ID. They also talked about culture and social environment. I think everybody else that was in my group, we'd have 50 to 60 people in the woods every weekend partying. It was like normal, and it makes me wonder where the hell were our parents really? I was gone for weeks at a time, like literally 13 and 14 years old. I missed 76 days unexcused in 90 days of school. And again, they talked about mental health. Someone talked about having panic attacks. They just pulled over to the side of the road to take a breather, and there was a guy out there and he offered heroin to me. One person was suicidal, ended up in partial hospitalization, and actually got diagnosed with mental illness. Increased need for mental health treatment. They talked about having many underlying mental health issues as being a reason for their substance use. Another theme was to decrease stigma from the community and medical professionals. So they thought they do face stigma from community members, medical professionals, and employers. And one person said, if you care what other people think, you're never going to go anywhere. I didn't use my supports because I was too worried about the judgment. So I just fell back into it. And finally, I was like, you know what? I don't care what people think. So it was kind of a process of, being afraid of the judgment and the self-stigma preventing them from getting help. They talked about, of course, we need to increase treatment centers up here in our rural northern Michigan. More resources here, especially inpatient. They wanted sober activities. These were referenced for adults, but I think activities are good for every age group. Providing education in the schools again, and providing education on medications. And then the last group was in Manistee County. And they talked about increased needs for mental health treatment. So that was a theme across all three counties is, if they could get treatment for their mental health, maybe they wouldn't have been so, easily using substance to self-medicate. They need improved support from the community, people making them feel comfortable seeking treatment and prevent relapsing. So that kind of goes along with, the stigma and judgment that they feel from the community. Again, decrease stigma, decrease barriers to care. So not only lack of facilities, but the cost, transportation, no internet, insurance, lack of insurance, all those play a role in having access to treatment. And so they feel that if they could decrease those barriers, it would help more individuals receive care. And they talked about increased recovery or sober activities. So create communities for individuals in recovery to strengthen bonds and give healthy outlets to socialize with one another. There's a lot of talk right now about the Surgeon General a few years back came out with a report on the epidemic of loneliness, and a lot of things have come out about especially men, and there's really a high rate of men dying by suicide as compared to women. And they attribute it to, social isolation. And so the group in Manistee recommended against adult recreational sports leagues, prevention or recovery camps. So camping for those in recovery to help build life skills and create those social bonds. They talked about having maybe an employment liaison, so someone to bridge the gap between treatment or incarceration and help find job opportunities. Recovery Job Network, connect with community partners and organizations that would hire individuals in recovery. And a step process for peer recovery coaches. So allow them to help others sooner without putting their own recovery at risk. So I'd like to, engage you guys in some conversation about, what you saw from these focus groups. And I can send Suzanne the focus group reports if you want to see the full report. This was just kind of a brief highlight. But I'd like to ask, what stood out to you in these reports? What was something that really caught your attention?
For me, it was the two main things that I always thought was the trauma and age of first use was seen over and over again around the 13-year-old age and the trauma.
Yeah.
For me,
Anybody?
it was how they can't get into, it's easier and cheaper for them to get it on the streets than it is to go to a doctor for whatever reasons and excuses or time constraints or I know even getting into it takes time, it's months sometimes to go see a psychiatrist. So that bothers me a lot,
Yeah.
especially if you have regular insurance. I know it takes months to get in to see a doctor. So that baffles me. I think that's so wrong in our society, but
Yeah.
Absolutely.
and that's just
Yeah,
one thing. I could talk about that all day. This all I mean.
It's
There's-
Yeah, we
frustrating.
really need some advocacy to
And we just
get
could
things
do
up in northern Michigan.
we can do billboards all day and we can be in
Mhm.
schools, but if we can't be there holding hands and showing them, like we can get through this together and be there with them when they're getting off the bus and learning about their dad passing, like it just breaks my heart.
Yeah. Yeah.
I thought it
Well,
was interesting that so one of the prevention programs that we have always states that mental health starts before substance use disorders, where in here you see they were using because of their mental health disorders. So it's kind of opposite, which I've always kind of bucked that thought myself, because just knowing the people that I know, the mental health conditions were there prior to the substance use disorders.
Yeah, and Jody, to your comment, I was at a conference in Lansing and somebody from MDHHS was talking about how great it was, the expansion of the CCBHCs. So for community mental health, some of the community mental health can actually serve more people than just people on Medicaid or with the severe mental illness. And she said, they really had expanded that number in Michigan. And then she showed a map on the screen, and all of the CCBHCs, there was not one in northern Michigan or the UP. So yeah, they've expanded downstate, but not up here.
Right, and the health homes we have now and everything that we've expanded, it's still in that population. And
Yeah,
I think that's really great for that population, and they're all working together now. And the doctors and the community mental health and everything is all in one, house, but it's those, the people I kind of call it a donut hole, they have the insurance, but they're waiting.
yeah,
And then what
yeah,
happens during that wait time, if you're a male, white, don't have a job.
yeah. So I don't want to put you on the spot, but from law enforcement perspective, did anything stand out to you?
Just the need for more clinics, more mental health help. Um, that's something that we've seen over and over again. I've talked to people um, who says that there's not enough mental health professionals, that they make an appointment and all they want to do is just put them on drugs, and they don't want to be on drugs. They want to get help for their mental health, but whenever they try to get help for that, they just seem to want to stick them on drugs, and it's a balancing act between the two. Um, but just that lack of resources that's out there seems a reoccurring um, situation.
Yeah,
I love the idea of the camps and the groups and the things and getting together, but we do that for the youth. We have funding for that, a lot of youth camps, but we don't have a lot of things for adults. I think that is a great idea. Um,
Well, that being said, here in Kalkaska, our programs, we promote them for families.
yes,
And
and it's
so
great.
families in recovery, I mean, we do background checks, but it has never do we turn someone away because of because they had substance use in their past. So we're just looking for CSCs and stuff like that. So we are really trying to promote families, doing these outdoor activities and working together. And I understand some of these, some people don't have kids, but that doesn't mean they can't volunteer and do these things, give them purpose.
Yeah.
And then
does
we have
anybody else have any more comments about?
we also started our recovery group, our recovery, not group, but activity, the Talents of Recovery Up North, which is already out. People can already sign up for that as an activity for people in recovery. And we're talking about if we can expand it, doing a hike, having it the whole weekend. We'd have our Talents of Recovery Up North on one day, and then another day hike the North Country Trail through Kalkaska County. But we need more people signing up who are in recovery.
Right. Everybody says it's a great idea, right? And then you have all the people that go for it and spend time wanting to do it, and then you got to get the people to show up. So
Right. Yeah.
I know, it's like having a meeting.
Right. Exactly.
So did anything surprise you that you didn't really know? Or was it pretty much what you, kind of the things that you thought were barriers? And I see Suzanne nodding her head, pretty much what she thought.
Yeah. Yeah. Well, after seeing these a few other times and, you know, knowing people in my personal life, yeah, it
Yeah,
was pretty spot on.
yeah, I think what surprised me was maybe the young age. I mean, and the trauma. I mean, it's just hard to imagine, but I guess that it happens.
I
So
think with Go ahead, Jody. Go
With
ahead,
the
Jody.
with the focus group, like when when they come together, like what works for them, the positiveness that works for them is getting together with other, like the one group, the T, getting together with other people doing like-minded things. That's what works for them. That's what they like. That's what's
Mm.
positive outcomes for them.
Yeah.
Because that's what I get a lot of people like, I saw your billboard, but then what do I do? Or who do I contact? Or how do I get involved? Or how does that help me? Yeah, don't do drug, or don't, just say no, say it back in the day, or okay, I can, but how's that going to help me tomorrow or in an
Right.
hour? Who do I call? Or what's my next step? You know, that's where I get things, back in my face sometimes. If
Yeah,
my logo is on something.
it's hard because some people, when they want recovery, they want it now, and tomorrow could be a whole different story.
I
I
mean,
mean,
10 minutes is a long time for some people, right?
it is. It really is. It really is. And the waiting game just doesn't work most of the time.
Yeah, especially if you're calling access or you're trying to get into services and you're going through those questions, or
Mhm. A lot of times they can't even focus on the questions,
no,
all the questions in the interview and everything, they're not there.
no, it's quite a process.
Mhm. I think that's why the Michigan State Police Angel program and even FANS program, we're having someone there helping them, walking them through the steps is important.
Yes. Holding, just being there for their support. And the case managers we have too, with mental health and everything. It's super important.
It takes a team.
So to drill down, what are your ideas that the Live Well Kalkaska Coalition could focus on? Is there any ideas from these that
But I think some of it we're already focusing on,
yeah.
like I said, we already have when we promote our youth and family activities. I make a point to say people in recovery or families in recovery are welcome, because a lot of times they don't feel welcomed. Um, Transportation, uh, what is it? 217 recovery.
Mm.
Yeah.
Mhm.
They are available. So I think sometimes they just don't know the resources that are out there.
Yeah.
I think, um, let's see, employment liaison, Michigan Works. Don't they have a program? Especially for people coming out of incarceration.
And some of your peer recoveries are in the jail. Some of your QRTs, I don't know about Kalkaska, but I don't even know the jail situation over there right now, but Grand Traverse, I know, have that. Um,
Yeah, they
and
have the
Cedar Major too had the,
before, during, and after incarceration group, the
Yep.
BDAI.
Yeah, I'm on the board of that.
Are you?
Yeah. Yeah,
Suzanne,
that's,
what you don't do, girl.
I did back up a little bit because I'm doing so much in Kalkaska right now, but um,
I will add in that there is a Road to Restoration event happening with the Secretary of State in Grand Traverse County. And that is April 24th, Friday. And there is BDAI that is involved. Derek from the Munson Behavioral Health then the offender success is what is with Michigan Works, Suzanne.
Yeah.
I
OS,
believe.
yeah, OS reentry.
And yeah, and that, yeah, as well. And there's oh, I'm forgetting her name right now. I didn't write it down, but you would probably know her too. And that's being kind of let out with the Community Recovery Alliance.
Mhm.
And NEMRIC is supplying some materials, and they're going to have a lot of resource tables there, as well as attorneys to help people kind of navigate through. And then there'll be some people to help them fill out applications for SOS. They're also looking to have actual driver's training test so they can actually get their license that day. So that's something good happening here and addressing. One of the most needed things is for them to get a driver's license coming out of jail. So
Absolutely.
Well, I think too, like Suzanne said, maybe people don't know about the resources available, and I'm thinking of, the wait times for mental health care. It is in Traverse City, but she'll help people in a lot of other counties. But NAMI Grand Traverse, that's the National Alliance of Mental. They have an actual navigator that's a paid position, and she has found people treatment services when they've been told, she knows this long wait list. So she's really helped a lot of people. So that is available, but I don't know how many people know about that.
I think it's
Yeah.
becoming more well-known, because actually that position, somebody new has just been hired into that position.
Yeah.
And yeah. And so she was at the community advisory group meeting a week or two ago. So that's being promoted, but she's also going to be having a location in the crisis center.
Yeah.
So that,
Yeah.
I think the crisis center is going to be huge.
Oh, it is.
Yeah.
Yeah, NAMI's really wanting to have a presence there. I was hoping. I'm on the board of NAMI Grand Traverse, as well as I'm president of the NAMI Wexford Misaki affiliate. So, yeah, we were writing a grant to get some money to staff Jesse over at the crisis center.
Oh, that's great. Well, it's glad it went through because I think she'll be great.
Yeah.
So just so I mean, a lot of people know about our resource guide. It's got a ton of information in it, from recovery to mental health to human trafficking, MDHHS, let's see, both community mental health in Kalkaska and Traverse City, because a lot of times our people, they end up going to Traverse City. It's got recovery homes, Michigan State Police Program, FAN, all the different recovery programs, inpatient and outpatient, Father Fred Care, District Health Department 10. And we always have these out when we at our tables. But I think one of the things that we could do in Kalkaska County is take these resource guides and put them in different locations throughout our county, like over at the courthouse. We did that a few years back with our old one. But we still have quite a few left. I think the only thing I need to update on this is I'd like to put 217 recovery for transportation on there.
Zan, do you have an online version?
I do. I can send it to you.
Where is it online where people can?
Well, it's not really online. It's
Oh,
it's a digital form. It's in a PDF
okay.
that I can email to you.
I do think
Is that
that's one of the
thinking-
best resource guides I've seen. I
Yeah.
wish we could like copy for all of our counties.
Yeah, I know I need to make it some of it smaller. Well, there's a couple things I could probably take out of here because I mean, fan we don't need. Like the Stronger Together in here, so I could throw 217 Recovery in here. So we still have a few of these left. So as soon as we start running low, I'll update it.
Where is it at, Suzanne? Online?
Well, it's actually I could put a link to it at our, so I don't know if everybody knows, but we just we have a link to a map to all our naloxone distribution boxes in Kalkaska County. So I could put a link there to a PDF. I could put it in a Google Drive where people could pull it up.
And then I could put it on the drug-free website too.
Yeah.
And I'm thinking, Suzanne, I could put it on our Northwest Shire Behavioral Health.
Okay.
So we have a lot of resources on our stigma page, and we have resource guides, so we
Yeah,
could put a link to it on there.
yeah. Yeah, I can put it in Google Drive and then send the link out, and also so people who might be looking for naloxone, it would be right there as well, so they'd have all the information.
Yeah.
So,
I
yeah.
wonder, Suzanne, if you can put that under your coalition and the Catholic Human Services website.
Oh, I could probably do that too. Put a link to it.
Yeah,
Yeah,
because
yeah.
that'd be easy for, like, that's an easy route to just, even for general public to look for it.
Yeah, we're talking about because right now we're on Facebook and a couple other social medias. But we're talking about starting our own page. So we'd have all this information right there on our page. Okay,
And
so
if you go to our northernmichiganshire.org/behavioral health initiative, and then you can scroll down to the stigma substance use, and we have all of our resources. We have social media posts, we have, and I'm going to put these focus group reports on that site as well. And we have, the stigma survey results. We have our videos of people in recovery. And we want people to, use those things on our website. We don't want it to just sit there. So encourage people to go explore it. And, if you want to use the social media posts, take them and use them. If you want to use the video in a presentation, or anything in any grants, if you want to use what's in some of these recovery focus groups to justify need in our communities for grant writing, we want you to be able to use that too. So,
Dave, John, do you have any input? I know you guys kind of hopped on a little bit later.
The hardest thing to do is, I mean, the information's all out there. It's obvious just through our listening to the conversations that we're having right now. The information, the resources, they're all out there. It's the hardest thing is getting them to the people that need them. Because the guy, the people that I work with aren't looking at Live Well Kalkaska Substance Free Coalition Facebook page.
Right.
yeah.
Ways, yeah, I always bang my head trying to think of ways to get it to those type, people that are out there using and running and gunning right now. When I do the resource table at the homeless shelter. And then over at the church here in Traverse City on Thursdays, when they have breakfast and lunch, that's the group of people that can that need these resources,
Mhm.
and they come to the table and we talk to them and get it out to them. But I guess that's the biggest thing that's been going through my head is, yeah, we've got a lot of resources out there, but how do we get it to the people that need it?
Right.
And that was one of the recommendations from the one focus group, is to connect resources to the homeless shelter. So I think
Well,
that's a good point you bring up, John.
the resource guide that I have both the PDF and a Word form. So the Word form could be modified to be Grand Traverse County. So it could be, you can put whatever you want on it and take whatever like Kalkaska resources out.
You want to
And then-
send that to me, Suzanne? I will
Yeah, absolutely. I
do
can,
that. That would
yeah,
be
I
great.
can send it to you. The Word one, you just,
Okay,
just change it around, leave what you want on, and then add different things that might be, more in Grand Traverse County.
and where did you print yours, if I may ask?
So I actually locally,
Okay,
in Kalkaska County.
okay. So John, once I get those done, I'll get them your way for your tables too.
That'd be awesome.
Cool.
So yeah, and Linda, I even have let's see, I know I have, well, the human trafficking on there, but I think we printed this before the coalition started out.
Oh, yeah, yeah. So I can add that.
Yeah. So, but this will be up, I mean, as soon as we use them up, we'll kind of move things around and add different things to it. I'm always updating it like every couple years, so.
Yeah.
So yeah, I'll work on that today. I'll create a link to my guide. Linda, I'll send you the Word form. And then I'll send the link to you, Donna, for the Kalkaska Coalition one, and then I'll put the link on our map for our naloxone distribution boxes. We do now have 12 boxes in our county. So we only have
Yeah.
4 townships that don't have them. We're working on Spring Lake Township. And then it's funny because after Spring Lake Township, because they're talking about it. I don't know what they're thinking about, but it's a strip of townships just like straight down that don't. Oliver, gosh, what was it? It was Oliver, Excelsior, and I can't remember the other 3, but they're all straight down from each other. So, but I don't think there's much in it to place a box except for the township halls. So,
Yeah, we have some ghost towns too that in Antrim County that one suggestion though I had, because I reached out to other PIHPs and they had said that they'd go to townships, they help stuff envelopes to when tax time's coming, and they put in there where they're located because people do have to go in and go grocery shopping maybe and the busiest places. So maybe just to let them know in those deserted, areas that this is where they're located. That's just an idea.
Donna,
Yeah,
do you have a copy of that presentation that you could,
yeah,
in PDF form or something, you could email me?
yeah. Yeah, I can send it. Do you want me to send it to you, Suzanne, and
yeah, you can
you
send it to me and
out
I
to
can share it.
everybody?
Yeah, I can share it with the coalition. Yeah.
Okay.
Could you get it? Is there any chance you could get it to me by like 11:15? Because I'd like to take it to
Yeah.
I go to the Antrim County Jail this afternoon and I'd like to
Oh.
take it and use it in our groups this afternoon.
Oh, yeah, I'll send it to you right away.
Okay, thanks.
Yeah. I really want to get this information out there because, we did the focus groups and I don't want just a report just sitting there, nobody
Yeah.
uses it. So this is great if you guys can share as far and wide as you can. Get the word out there.
Yeah, are you gonna be showing the slideshow at the what is it? The harm reduction conference?
Oh, yeah.
Everybody's going to that, right?
Oh, yeah.
Suzanne, did I send you the flyer for the perinatal
I don't think so.
SUD harm reduction training, virtual training?
I don't think so.
No. Oh, I will send that and you can send it out now.
Okay.
It's April 24th or 25th, I believe, and it's virtual.
Okay.
Last time I looked, we already had 250 people registered, so
Okay, yeah, send it to me and I'll send it out to the coalition.
yeah,
A
it's
lot of times
being
Jody
put on
grabs
by
it, sends it out to everybody.
yeah, the National Perinatal Harm Reduction Academy they're giving the training, and they did an in-person one in Charlevoix last month. And everybody was saying how wonderful it was, so I'm excited to participate in the virtual one.
Donna, I just put my email address in the chat.
Okay,
Thank you.
yeah.
Appreciate it.
All right. Is there any other questions or anybody want to discuss anything else that pertains to the slideshow? No?
Yeah.
It's 9:49. Well, we can end early. All
Great
right.
Thank you,
slideshow.
everybody.
Yes.
Great
So,
discussion.
yeah, our
Thank you. Yeah,
next
good
coffee with
discussion.
our next
Yeah.
coffee with the coalition forum will be Tuesday, May 27th at 9 a.m. right here on Zoom. Not sure of the speaker yet. I'm trying to get I can't remember what his name is. Somebody to come in and talk about marijuana in youth. So
That'll be a good one.
Yeah.
All right. See you. Thank you, everybody.
Nice
Yeah.
to
Thanks,
see you
everybody.
guys. Bye.